We are going to discuss types of advanced directives and what you as a healthcare provider need to know about patients with advanced directives. A medical power of attorney is a type of advanced directive that allows the patient to name a person to make healthcare decisions for them in the event that they are unable to do so themselves. Medical power of attorneys only go into effect when the patient loses the ability to make decisions for themselves and the MPOA is unable to override any expressed wishes outlined in the MPOA or post form document. As a healthcare provider, it is important that you know what these documents allow representatives to do. Patients should be asked if they have an MPOA on admission, and a copy should be placed in the chart. MPOAs can be updated by the patient as often as they would like. Asking about updates to their MPOA is an important step in the admission process. A living will is another type of advanced directive that the patient will fill out that dictates how they want to be treated if they are terminally ill and cannot make decisions for themselves. A living will may indicate what type of treatment the patient would like, including but not limited to invasive procedures, IV hydration, and resuscitative measures. As a healthcare provider, it is important that you ask a patient if they have a living will on admission and that you read the treatment limitations the patient has outlined so that you follow the patient's wishes. In the event that a patient has not already designated an MPOA and the patient is unable to make medical decisions for themselves, a healthcare provider will appoint a healthcare surrogate. Healthcare surrogates follow the same rules as an MPOA in that they should make all medical decisions with the patient's best interest in mind. And if the patient regains the ability to make decisions for themselves, the healthcare surrogacy is voided. A post form is the voluntary West Virginia state form that acts as a medical directive. They can also be used in conjunction with advanced directives. They are always printed onto pink paper and should always be copied on pink paper. This paper will go in the front of the patient's chart on admission, and a copy should also be given to the patient. The patient should be encouraged to hang this in a highly visible area of their home in the event that emergency personnel respond to their home. Patients can update their post form as their wishes change. It is important that we ask about any updated post forms at each patient encounter. As a healthcare provider, you can give the patient an NPOA, living will, or post form at any patient encounter. We encourage it on admission so that the patient and their family can begin to discuss the patient's wishes. Oftentimes, these decisions are made at an emotional time, causing added stress to the loved ones. If we can start the conversation early, the patient can have an open and honest conversation with their family to express their desired wishes. By having a post form on file, we can advocate for the wishes of our patients.